Hi, everybody, and welcome to Pharmacology 6015. My name is Dr. Peters, so if you are supposed to be in my course, you're in the right place. I'm so excited to teach this. I love pharmacology and just really excited to dig in, and I hope that you are too. I'm sure you're a little nervous as this is the beginning of the program for you, but just be reassured, trust the process, and as things go on, yes, the program in general is challenging, the course is challenging, but if you put in your 100%, then you will be successful. And my goal is to make you be successful in this course. So, first things here, I am going to be meeting with you separately for an orientation. Just a little bit about me. I've been a nurse, a registered nurse since 1994 and worked in a variety of settings. My last 10 years of practice has been in cardiac step down. I've also been a nurse practitioner since 2007. I got my doctorate, my DNP in 2011, and I've worked in various settings also, hospital rounds, nursing home rounds, family practice, internal medicine. I worked in a pre-op clinic, and I also worked in urology before. And as you become a nurse, you realize that nurses have multiple jobs at the same time. So this is my full-time job at this point in my life, and I also work in the clinic, and I'm also course coordinator for 6970. So I do get my feet into the hospital setting also. So that's about me. I am married to a wonderful guy named Patrick, and we have 5 kids together. And our youngest one is 16, no, 17 now. And I have a 19-year-old at Marquette. He's a sophomore. And we have a 27, 28, and 30-year-old. So, anyways, and grandkids. And we have dogs and cats. So if you see a cat roaming through here, I closed my door today, but you might see a cat. Okay, so textbook. This is the textbook we're going to be using. It's the Karch book. And it's connected to the online Course Point Plus, which in the syllabus, there should be a code and instructions how to get in. It's actually a plethora of resources that you can get for learning. So it's really nice. I think it's set up nice, it's organized, and this course is very organized too. This course was set up very intentionally for active learning. I know traditionally we are used to PowerPoint presentations and more lecture style, but this is actually the way to learn. You have a lot of different areas to go to, but yet it's more hands-on, it's fun learning. Yes, there is still some readings because yes, we have to read to gain some of the information, but overall, the students really love the way that this online course is set up, and many of them through the program are set up that way. So first things first, what I'd like you to do is make sure that you print out the syllabus here. And the syllabus is big, it's long, or if you keep it online, however you guys learn the best. And that's the other thing, is how do you learn best? Everybody uses all different ways, like hands-on versus reading versus listening, but we usually have a predominant way that we want to learn, which is another reason why we have this course packed with different ways to learn. Okay, so go through this and make sure you read it in detail. All of your weeks are detailed here, but it aligns with what is in the Canvas course in the modules. That's how that's what you're going to be doing. You're going to be going through the Canvas course week by week or module by module. So if you bring up the course schedule, you will see the schedule here. That's just a condensed, and then this is more detailed to move you along through Canvas. I always say to read these types of things more than once because you have to get it in your head. However you like to organize, whether you use electronic calendar or whether you use a paper calendar. I'm old, so I've got my passion planner here that I like to decorate and all sorts of fun stuff. But I put every single date in there and I work day by day. And when I was in school, I planned day by day, week by week. All right, so just a few things here. I am going, like I said before, I'm going to be meeting with you to talk more in detail about things, but I want to give you 10 things to help you be successful in this course. And that we have found that really works, and we get this from student feedback. Number one is do your readings. So this is not a course where you can go in and not buy the textbook and get through it. So you have to get the textbook. You have to do the readings. Also, watch all the videos. So as you go through each module in Canvas, there's going to be learning points. So in the beginning, introduction, there may be some video links in there for you to watch, and as you move down. So go through the module from top to bottom, in between, but go through each module. You'll get the hang of it after a couple of weeks. So all the videos, everything that we put in here is intentional, that we've created to make this course successful for you. The number 3 is self-assessment questions. Those are the quizzes at the end of each module. Taking exam questions, number 1, prepare you for the exam, or quiz questions prepare you for the exam, and also help start to prepare you for NCLEX. NCLEX is a combination of knowledge and test taking skills. You have to take multiple questions, test questions, quiz questions to be prepared for the NCLEX. If I taught you everything now and you only wrote papers, sorry about that, and if you only wrote papers, you would not be prepared for NCLEX. So make sure you do the self-assessment questions. Number 4 is virtual simulations, and that's in the Course Point Plus. You will have 5 of them to do through the semester, and it's hands-on. You have unlimited times to take each one through the week, and we take your highest score. So again, read through the syllabus carefully, as that will explain it, and then I'll be available to talk more and answer questions. You received a course code in your syllabus, and you should be able to get in and sign up, and then you see your course there. What are we on? Number 1, 2, 3, 4, number 5. All right, Prep U quizzes. So you have 6 Prep U quizzes. That is within the Course Point Plus. I have them all set up, ready to go for you. You have to meet a moderate. So say, for example, the mastery level that I have set is 3, but the max is 6. So it's not like you have to, take it for hours on end. But again, this is another thing to help prepare you and learn the content, understand it, and then also help prepare you for the future for NCLEX as well as these exams. The next one is Quizlets. We make the Quizlets. They're there for you. We intentionally make them, and make sure you practice with those too. The next one is your medication teaching videos. When you are out in the hospital setting, which you will be next semester, you will have to do some teaching. You will be passing meds almost every single week you're there. So this is why these teaching videos are very important, to get practice teaching one another and also practice asking questions. And also looking things up. How are you going to look up a specific drug that a patient is taking? If you look at the instructions in Canvas, it is detailed and even gives you an example medication card and even how to make a medication card. The instructions are well laid out, but I'll make sure I go through that with you too. The other thing, I know there's so many drugs. I mean, gosh, I don't know every single drug. Now, over the years, I know most medications that are out there. And you know what? You're not going to know them all. And if you don't know them, you look it up. So for this course and all pharmacology courses, try to understand the classifications. This course is going to go through classifications of drugs like antimicrobials, that's your antibiotics. Antihypertensive drugs, those are your blood pressure meds. Yes, there's a lot within there, but if you understand the classification of each drug and or each class, then that's going to help you understand the individual drugs. So we really focus on drug classifications instead of particular individual drugs. If there are, I will just be discussing that. The other thing is discussions, is KWL, what to know, what you want to learn, and what have you learned. This is a different kind of discussion board than many classes maybe you've taken in the past, where it's you post, then you post 2 replies, and then that's it. This is actually, the students love it. It's a more robust conversation, and it's basically how you feel and how you think things are going. What do you know? What do you want to learn? And what have you learned at this point? So those are going to be scattered through the semester. The other thing is I'm going to have weekly meetings, and my meetings, we play Kahoot a lot of the time. Sometimes I do case studies. So it just depends, what week it is and what I have packed in my arsenal of review materials with you. But it's basically an exam review, but I want you to learn the material and understand it and not just memorize. Yes, some things you have to memorize. I get that. But overall, we're going to learn about pharmacology. So you can go into the clinical setting next semester and do fantastic. And again, the expectation is not for you to know each individual drug, tons of them. You're not. You're going to have a few most common ones. And as you go into 6970 next semester clinical, you're going to you have a medication card assignment that you'll be filling out the most common drugs and having them ready for when you go into the setting. Stay engaged. I talked about that. All right, contact info. So on the syllabus, I have a Remind app. And I use the Remind app, and it's been very successful. So if you've not used it before, on the syllabus, it gives you a link that you can click on, or just type it in your browser, and it goes right to my course, and you just sign up. So you have to put the app on your phone. It's very simple. It doesn't cost any money. And what that means is you can text me anytime. I can text you anytime. And I can also send out group texts. So for example, say I want to give you a little tip. I can text it as a group text. Hey, don't forget this. Or remember, beta blockers are this. So I tend to do that through the semester. I'm not going to inundate you with text messages all the time, though. Trust me. As far as email and text, you can text me or email anytime. I'm not real strict with that because I figure you guys know that I don't work night shifts, so I do sleep at night, and I'm sure if you text me in the middle of the night, my phone's always on silent. I will get it in the morning and I'll text you back. Or if you email me, you can email me 24/7, does not matter, but give me about 24 hours to get back to you. I'm usually very fast at getting back to you. Now, if you notice that you don't hear from me in a couple of days, just email me back. I have had times where it's gone to my junk mail, but that rarely ever happens, but just to let you know. Sometimes I'm out doing something and I read the email and then I think about it. I know when I'm going to respond, but I want to get to my iPad because I can't type as fast as younger people can on a phone. It's just, I don't know. I just have a hard time with that. So, but anyways, I do text from my phone, just not long conversations. All right. So there'll be a future date and an email coming out, or maybe you got it already at this point, of when we're going to meet virtually. And what I want you to do is write down your questions as you look through everything, even maybe as you have listened to me babble on for 13 minutes. But when we meet, I want to be able to answer your questions. All right, and good luck in the course. Again, my goal is to make you successful. I'm here for you, and you take care.